Hello everyone. My name is Dr. Shahriar. I hope so everyone is doing well. So many inquiries all the time I got actually, like I'm a fourth year student, I'm a fifth year student, I'm studying second year. Can you suggest me something? Well, at this point, the main suggestion is to finish your MBBS at the same time. Few of the addition that can be added along with your syllabus, that some of the good books that I can recommend at the same time. Like example, when you were studying in the first year, so you can add a extra book like anatomy book. I mean, a good anatomy book can facilitate your study for some of the future degrees. Like there's one book, very small size book, its name is Gross Anatomy, so you can read that book, find it out actually. Secondly, in the first year and the second year Physiology, you can add a book name is Linda. So we have the Guyton Gannon, this kind of book, but Linda can be an additional help, especially those of you are planning for USMLE, but not only for USMLE. Physiology is like a hub, that's a bond for pathology and medicine, a lot of things actually. So it's very important you understand the good physiology. A good doctor knows good physiology. There is a word like that. And also, if you do degrees of your own country like FCPS, MD, you again need a lot physiology. All right, now coming to some of the other topics like biochemistry, the authentic typical biochemistry, to be honest, we actually don't study. Whatever that comes in MBBS, we read that part actually. So biochemistry I won't recommend that much, except for there are books like Lippincott or Kaplan, but not much biochemistry is recommended at this point. Just read to pass the exam. Third, after this particular year, then there would be community medicine. What a waste of time. I mean, I can tell from my experience, nothing was actually beneficial what I read from community medicine. So I'll recommend a request to the teachers, please be a little bit more focused for the future of the students. What is needed in future, try to teach them those things. Just please do not focus on the definitions, that those teachers also, I feel with due respect, need a little bit more training, or especially on the community medicine. I'm not talking about the MPH expert. Even if you ask the MPH expert, they all said that whatever they learned in the community medicine in 2 years was a total waste of time actually. We don't understand how to do the biostat, we don't know how to do the calculation, pie chart and all these things. I'm talking about mostly the subcontinent students. We all usually have gone through this kind of problem with community medicine. So those of you who are reading community medicine, just do it for the passing the MBBS actually. Those community medicine you're learning, no need to focus too much, just read for passing the MBBS actually, no extra effort for that one. All right, now some can be asking, Dr. Dan, what is tested in the next level for community medicine? It's a little different, the biostat, epidemiology. If you go to USMLE, you can check in the Kaplan books, but during MBBS, I mean, I want you to pass the exam first actually. So do not waste that much time on the community medicine. If you actually go for USMLE, then you can read those things from the Kaplan. Also, you can go to YouTube channel and can type few things about the epidemiology videos, biostat videos. This can be some of the ideas if you want to take exchange. If you're a very good student, you can also do this kind of thing. Next is coming one of the point, the pharmacology. Pharmacology, one of the very great book is the Lippincott Pharmacology. Another great book, I would say, like the Kaplan is also good, and pharmacology made ridiculously simple. I mean, that's a book of mnemonic. You can collect those mnemonic from that book, and you can read the Lippincott. I read Lippincott, it was fine. Kaplan is a very fantastic book. Kaplan, one good thing, every subject has Kaplan. So, and Kaplan, they have their own videos, so you can also watch those videos by downloading it or buying it. No need to do subscribe at this point actually. Later you can subscribe when you actually prepare for your assembly. That time you need the latest one. Some doctor asked me about the Dr. Najib videos. Personally, I never used when I was reading. These videos are too long. If you are a sharp student, that's okay. If you are like a very weak basic, you don't study that much, I mean, you don't follow lectures of the lecturers, I mean, that cases, those are like a good foundation. That's like starting from the A to Z. I mean, if you need A to Z thing, then Dr. Najib's thing is good. Otherwise, it's not very I mean, nowadays things are changing, you know, it's like a 10 years 20-year back lecture actually. So I mean, very details. Now we don't have time for that much thing. Nowadays you see some of the small short web series are more popular than the full stem movies. I mean, trend are changing. So definitely one of the best lecture of the world, but you know, he also needs to make the lectures, I believe, in shorter size from now on actually. Just as a recommendation. Okay, like you can see osmosis videos on another very nice thing, like they came up with something new, osmosis prime videos. Like these are concise, like a 20-25 minute, and they concise the topics. Now that's more useful personally, I think. Now that goes the pharmacology. So one book if you want to recommend, I personally recommend the Lippincott. Next coming, all right, next coming is very important. I mean, your life can be changed, you know, that depends you are a good doctor or a bad doctor, or you know how much success you'll get in future. Is Pathology actually. It's a hard, I mean, one thing many of you don't study is systemic pathology. Make sure you are really good in systemic pathology. You put too much time on cell injury, cell, this thing doesn't test it in future. In future, the thing tested is the systemic pathology and some extension and some connection with the medicine. So systemic pathology has more connection with the medicine, so you need to focus on that one. So Pathology, one very nice book I read personally, my favorite, not Robbins, it's Golzan Pathology. Yes, it's a USMLE book, but where he has explained everything is the best explanation, each every line. And later and in the side he mentioned also things as a pearl actually, the nutshell and the pearl he give in the side of the books. It's tremendously good books. I mean, 5-star book I would say. Next, Pathoma is also good, and if you need some more shortcut, Pathoma is for you actually in that case. So those are good students, have more patience, go with the Golzan. Those of you who are, I mean, what should I say, you don't have that much time and you want shortcut, Pathoma can be a good idea. That brings us to the microbiology. For microbiology, Lange is always best book. I repeat, Lange is a always excellent book. So you can always go and read from the Lange. And not but let the list after that, some of the other subjects are coming, like the clinical subjects like medicine, surgery, gynae, psychiatry. I'll start with psychiatry. Most of you have kind of zero knowledge. When we got students for AMC, PLAB and USMLE studying, you guys actually have zero knowledge. I usually say in that way. Some might take it as offense. Some might be good student, they might have knowledge, but most cases 99% have zero knowledge on psychiatry. They just read about the definition of hallucination, delusion, illusion, what is obsessive compulsive maximum. But this level is like, you know, you are playing here and this level is here in the next level. I mean, when you come to USMLE, PLAB, AMC, even I mean some other post-graduation exams, I mean you really need, I mean, superior level of psychiatry at this. I mean, so I mean you are at this level, you have to go this level with psychiatry. Please keep that in mind. Okay, good book, Kaplan. I mean, AMC we follow Kaplan. USMLE of course is a Kaplan psychiatry, and even for the PLAB people, many of them they follow also Kaplan for the baseline. So baseline, excellent book is Kaplan actually. After that, one of the important subject is surgery. It's very tough reading general surgery from Bailey Love, with due respect, very good book. Norman Browse, very good book. SBS surgery, very good book. But thing is, you need a concise one. I might recommend you Oxford has a medicine book, Oxford has a surgery book, but Oxford maybe a small size. At least you can finish it well. If you are not comfortable with a small size book, then maybe Kaplan surgery can be a good idea for you. All right, so this is the surgery for, I mean, recommendation for the surgery. And now a little bit thing coming on the medicine. So about the medicine, so many books are there. Medicine, so many good writers actually. Medicine you can also make concise. One of the very favorite of mine is Master the Board. Okay, fantastic book, Master the Board. things are written really concise and very nice. One of the best book, as similar like I mentioned in the Goals and Pathology, one of the best books. Some doctor asked me about, doctor, you are tutor of MC Plab and also a lot of things you teach from John Murtagh. That's the next level. When you come to next level, then actually you need the John Murtagh, that book. Actually it's also good book, but when you come to this level from your after finishing the internship, if you actually plan for AMC, then the John Murtagh. Otherwise it's a little tough book for the beginners actually. All right, so excellent book. Master the Board, and all-time favorite Davidson Medicine, the tables. I mean, at least if you know the tables, read the tables, mark the tables, that's also fantastic. There are some notes also available in the market. Like some people, I saw some great guys, they separated all the tables from the Davidson and they just make a note actually. So it's a good thing. You can also do that. Collecting, I mean, see, following some others note is not beneficial unless you do it, my dear friend. That I mean, collect those tables. I mean, if you know how to do it in the online, that's also okay. Otherwise, you know, just open the Davidson Medicine and just mark the box, read the box, try to understand what's they have written there actually. All right, and try to focus on the common disease during MBBS. No need to read that much uncommon diseases. Some have a habit, I will read everything in the universe. It's not never possible actually. All right, so you read the common disease, like example rheumatoid arthritis, SLE. These are the common things of also of med school. So get more expert on that one rather than just reading actually like topic like Pius Jaggers. I mean, that's not so necessary at this point to understand. All right, next level, there will be a lot of things waiting for you. So the medicine goes, surgery goes. So cool books is Master the Board for Medicine and Universal, everyone. I mean, it's called Bible always, that the Davidson Medicine, every doctor should have in their decks actually. Still I have it, I mean, in my decks, I mean, all-time favorite actually. And next is upcoming surgery, then the gynae. I mean, personally the books I don't find as cool as medicine, to be honest. So the surgery and the gynae books are not as cool as the medicine books, but there are few. I mean, you can take shortcut with Kaplan. I would say you can take a little shortcut with the Kaplan. Actually, to be honest, in my institution I had to teach separately the gynae ops because I saw their knowledge is also not complete, because a little bit note and they memorize when they come to classes. So the gynae people still have, because of, I think there is no such great books actually also. So a lot of, you know, advanced knowledge, and especially those people, my dear friends, especially those are male dear medical students and my friends, you need to study a little bit more. I mean, I used to remember during gynae, especially those of us are male, used to get little special treatment from the madams. Some cases, I mean, not always. Okay, I mean, they are thinking that, okay, the female is going to gynae, the male is not going to. So many times we used to sit in the corner. But my dear friend, I mean, if you have planned to go abroad, definitely, you know, work hard even in the gynae department actually. Otherwise, you know, you will be left over with a lot of knowledge and lot of things actually. All right, so this is totally up to you. I leave it to you. Okay, so Kaplan is a good book, as I said, and there are some MRCOG coincide notes. You can also read that one for the gynae actually, as I said. Jeff Gott, then 10 teachers, then there are like that. These are very advanced level books actually. You know, some will tell, okay, good book, you might find it good, but it's my personal opinion that when we see the notes at the next level, when you make the notes at the level, we don't make notes from the Jeff Gott, we don't make notes from the 10 teachers and those we follow the coincide thing. Those comes in the exam. So from those books, it's written, but it's so many pages actually, so you have to memorize so many pages. That's the problem. All right, so there's some coincidence book, but if you want to take shortcut, Kaplan is always the solution. So I would say Kaplan wins here actually, maybe even in the gynae op section actually. All right, and last but not least, psychiatry I told already, and these are all those things. And my best wishes to all the dear doctors, and follow my YouTube channel. I mean, my YouTube channel name, you just have to type Shahriar Ahmed Sujoy, you will find that channel. I keep uploading and I keep motivating the IMGs. You can also make career, I mean, be a successful doctor. It doesn't mean that you have to always go abroad. Be a successful doctor, plan accordingly. You can be a great, I mean, from good you have to be great. That's the main thing. Have a good day. This is Dr. Shahriar signing off.